Hey everyone, how y'all doing? OTDUDE here. Hope you're all having a nice day. So today, let's talk about the Thedacare controversy. Some of you may have heard this in the news, especially if you're a nurse and you've been on the nursing subreddit. You might have seen the original post. Basically, the gist of it is what happened is some healthcare workers at a hospital in Wisconsin quit their jobs, 7 in fact, and they applied for a new company. And the CEO basically took legal action, and basically one employee sought a new job at another company and basically, at their own will, and they're in an at-will state. They quit their job and other colleagues did the same, and 7 ended up applying for this company. And basically the CEO sent out a letter to the company, and I have it right here. It says, "Colleagues, we recently learned that 7 of our 11-member interventional radiology and cardiovascular team of nurses and technicians were recruited by and have accepted employment offers at blank." And we now know this is Ascension. The departure of these team members comes at a time when COVID-19 pandemic and other issues are causing significant staffing and recruiting challenges locally and across the nation. That is true. That much is true. Yes. The action taken by Ascension, something to risk the many communities and patients served by our robust critical care services. Specifically, the hiring away of these employees en masse would impede our ability to provide care to trauma victims. And actually, I believe these employees quit voluntarily, and they didn't have like a contract or anything where, they're legally, I don't even think that's legal, right? To keep them from working there. For the victims at our level 2 trauma center. And for those of you who don't know, trauma centers are designated by levels 1, 2, 3, and so on. The lower the level, such as level 1, the more services they have, and the more comprehensive services, the more emergent and emergency kind of cases they can take, and the more they can do, such as having 24-hour certain staff on site, such as on this unit, versus like a level 3. So this is what they're talking about. Victims at our level 2 trauma center, and would potentially force a diversion of trauma victims from the 17 plus county area to the other one. And diversion means basically there is a concern, and I worked as an EMT basically, when you have to send a patient somewhere, you divert them to another location. That's lost time that could be critical, such as like a cardiac event or a stroke or something where they could be getting an intervention to save their life or, have a better outcome, right? So the CEO is using this kind of as a argument. Additionally, the staff who recruited and hired by Ascension play a vital role in our comprehensive stroke center. As a result of Ascension's action, we may not be able to staff 24/7 interventional care. So basically what's going on is, to be able to maintain this level 2 trauma center and to have this title, they need to be able to staff 24/7 with a certain amount of staff. So they're probably, what's going on is they have lost the staff and they're going to be able to fulfill this, and they're losing this basically title. And at the end of the day, that means they cannot provide the care, yes, to the community, but that also probably means lost money and the bottom line for the company, is my guess, which is needed for patients who come to us for the highest level of stroke care. And I don't know about you, but I don't think patients really choose to go to a hospital, kind of like you go and enroll in a college. I got accepted at a prestigious college. Like for me, I want to go to the nearest emergency center, the shortest amount of time that can provide me the care that I need, basically. As such, stroke victims may have to be diverted to, I don't know what they blanked out, or potentially as far as another county probably. These diversions, most of which would be longer than 1 hour, will undoubtedly have the potential to endanger lives. The CEO goes on to say, "We understand and respect that people have choices in the current highly competitive job market. Yeah, with healthcare workers and COVID-19, there is definitely a labor shortage, especially with healthcare workers contracting COVID-19, being just burned out in general from this pandemic. There's more demand, less workers, and just the overall morale is very low, right? And I'd say globally even. However, the decision by Ascension to hire away such a significant portion of our interventional radiology and cardiology support all at once at the height of the pandemic surge will disrupt access to critical care for the people in our region. While we have tried to work with Ascension for additional time to execute a plan for staffing coverage that will provide the long-term continuation of services that support trauma, stroke, and other essential services of care. Ascension wasn't willing to collaborate with us. Today, we have filed for a temporary injunction. So basically, they're taking legal action. With this legal action, yep, there it is. With this legal action, we are asking the court to grant the injunction to maintain the status quo until we can hire replacement staff for this vital department, which will allow us to protect access to the critical care services supported by our team. If you actually read into more of it, what's going on, well, the reports are that this worker that first left, that kind of started this kind of snowball, they actually gave opportunity for Thedacare to provide a counter offer, and they didn't grant them like a better offer. So according to the report, these workers, actually, they call them the Theta 7 now, at one point barred from working at the new employer, Ascension. So they were kind of in no man's land. They quit from their old job and they couldn't work at the new location that they got hired for like a day or however long, which to me is wild, right? Meanwhile, they can't like pay their bills or put food on the table because the CEO kind of got revengeful and wanted to take legal action. So the latest development as of January 24th is Thedacare loses court fight to keep healthcare staff who resigned. So I'm glad that's what the outcome was. Personally, I think it's kind of ridiculous that it even got this far. I mean, you know, we live in America. We talk about how there's freedom, and basically a lot of people, commenters online, are saying that the CEO was out for revenge. And is it really to keep the workers and for the community, or is it for revenge? I don't know. I'm not going to look into that side of things. Do you think it's unethical for a worker to not be able to quit and pursue and find a new job that is, for one, that is better paying, two, provides better benefits, three, provides a better work-life balance? That's what one of the members of the Theta 7 has said, you know, and you could even see this as, I don't like to use this word, but slavery, right? They're kind of asking these old employees to kind of stay there and work, and so they can quit and get a new job. I don't think they signed a contract so that they have to work at the old one. And it's not like this new company, Ascension, like poached them and stole all of these employees. They kind of applied on their own, at their own free will. And if you look at other industries, even I would argue like tech, it's highly competitive and employees are constantly bouncing around. And what I would argue is that this is actually good for competition and improvement and just helping overall those involved in that industry. Unfortunately, I think this is one of the dark sides of healthcare, such as hospitals, where, you know, they make profit. And it's kind of ironic. The CEO talked about the care that the community isn't getting from these workers suddenly quitting from this like level 2 trauma center, and now they're having to be diverted and precious time and resources are lost, when ironically these highly valued healthcare workers aren't even able to work for a certain period of time, and we have to go through this kind of legal thing and waste money and time and resources while patients need these crucial resources and personnel and skill sets. I was thinking, are they seriously gonna take them to court for this? It's 2022 and these are things that's going on. Let me know what you think of this story. I was really shocked that it even got this far.